We thank you for your participation and we look forward to a productive session together. And now please welcome Donna Uris to begin.
Hello, I want to take a moment to welcome everybody to the call. My name is Donna Uris. I'm the chief of the BHSA branch at the Department of Healthcare Services. Oh, I'm sorry. Next slide, please. Today's session is focused on guiding you through the process of completing the integrated plan template. Our goal is to provide additional information that may be helpful as you work through developing your integrated plan. Can you go? Yeah, we should be on the slide that says webinar focus, please. Thank you. Please note this session will not cover the policy background or rationale for the questions included in the integrated plan. For all policy related information, please refer back to the County Behavioral Health Services Act Policy Manual. I encourage you to ask questions throughout the session using the Q&A box, and we've also set aside time to address your questions. At the end, we want to make sure that you leave today with the information you need to complete the template successfully. Next slide, please. Today, we'll walk through the key components and milestones for submitting your integrated plan. We'll start with an overview of the submission timeline. Then we will review the BHSA components, including BHSS, FSP, and housing interventions. And end with the workforce strategy section. Next slide, please. One more. Thank you. So I included this in the slide deck from a couple of days ago, but for those who did not attend, just want to quickly walk through the IP submission timeline. So as I mentioned, the timeline is anchored by two key deadlines. The draft IPs are due March 31st, and the final IPs are due by June 30th, 2026. And this is for the 26 through 29 cycle. Just a reminder, drafts must include a letter from the county administrative officer and approval from the behavioral health director, including the exemption and transfer requests. Early and complete draft submissions are definitely encouraged. Additional requirements before submitting the final IP include the requirement to circulate the draft IP for 30-day comment period. The local behavioral health board must conduct a public hearing on the draft IP at the close of the 30-day comment period, and the final submission must be must include the approval from the behavioral health director as well as the local board of supervisors. Next slide. Thank you. In the integrated plan, counties are required to describe the BHSA funded programs that are planned for implementation over the 3-year period covered by the plan. Detailed program descriptions and projected expenditures for each component in the IP budget are required. Can you please go to the next slide? Thank you. Perfect. The integrated plan requires counties to indicate which behavioral health services and supports are planned. A dedicated section for each BHSS category will provide space for detailed program information. If multiple programs are planned within a particular category, counties should reflect each program separately. And perfect, thank you. For our systems of care programs, which are not including those FSPs, we're required to describe the service type, whether it includes mental health, supportive services, or SUD treatment, and the projected number of individuals to be served. In the integrated plans, estimates of projected individuals to be served will be provided by each individual program. And in the integrated plan budget, counties will provide an unduplicated aggregated total number of projected individuals served under BHSS. Next slide. When estimating the total projected number of individuals served each year, counties should consider their community needs and their program capacity. Counties are also encouraged to use a variety of data sources, including local needs assessments, epidemiological studies, and feedback from community stakeholders to determine the projected number of individuals served. Next slide. Questions. Are there questions on this particular section?
Not on this particular section in the Q&A as of yet, just a general question that I'm working on.
Okay. We'll give it a minute and see if any hands pop up. Okay, if questions do come up or you think of something to ask, we're happy to take it in the future as well. Next slide. So early intervention programs. As you know, counties are required to provide all required early intervention components. And that would be outreach, access and linkage, and treatment services and supports. Counties can develop multiple early intervention programs, and the EI programs can meet more than one requirement. All EI programs must be reported in the integrated plans. Next slide. Counties will review the forthcoming evidence-based practices or community-defined evidence practices biennial list. The list will be made available in future policy manual guidance, and it's expected to be released with Mod 4. Those EI programs implemented do not need to be on this list, so counties are free to provide other evidence-based practices or CDIPs that are outside of the list. Counties will report the intended outcomes of the EI program or service. And as a reminder, EI programs must be targeted to eligible at-risk individuals. They cannot be broad population level prevention programs. Coordinated specialty care is a required service under BHSS. DHCS will provide estimates of the number of individuals eligible for coordinated specialty care in fall of 2025. These estimates will need to be included in the integrated plan. These are data-driven estimates that are being developed in partnership with CalMesa, and counties will review and include the estimates provided to them in the integrated plans. Next slide. DHCS will also provide counties with estimates of the number of practitioners and teams that are needed to serve the eligible estimated population for CSC. These estimates will need to be included in the plans. And it's DHCS definitely understands that there may not be sufficient staff or funding to serve all eligible individuals at the local level. Next slide. The number of practitioners and teams planned for CSC during the first integrated plan period should be provided, including both existing and newly hired staff. If a CSC program already exists, those teams should be included. The estimates provided by DHCS should be reviewed and adjusted based on community needs and available resources. And DHCS intends to offer training and support to facilitate this high-quality CSC programs. Next slide. BHSS funds can be used for outreach and engagement activities. However, these funds cannot pay for outreach efforts required for early intervention or for FSP and housing interventions. As a note, BHSS funds can be used for funding intervention outreach or for funding housing intervention outreach if those activities aren't already funded somewhere else. All outreach activities need to be tracked under the correct BHSA component in the integrated plan. The integrated plan requires counties to report on workforce education and training activities that are funded by BHSS. So BHSA funding for WET activities directly addresses those county recruitment and retention activities. And counties should continue using state programs like BH Connect and the HCI workforce programming alongside BHSA. However, these specific programs should not be included in the integrated plan. Next slide, which brings us to our next set of questions.
We did get a request from Raven that we slow down a little bit. We also have a question hand raised from Noah.
Noah, you can go ahead and unmute yourself if you'd like to ask your question. Noah, can you hear us? Okay. Guess we can move on if he doesn't have a question.
Okay. We've got a few questions going in the chat while we wait. It was asked if we can provide more examples for eligible outreach.
Eligible outreach activities?
Yeah, that was the context that we had there. We have a request to go back to the last slide as well. All right, and then the clarification was provided for the eligible outreach that yes, that's what they were asking, Donna.
Let me find this. Where was the slide that we were just talking about with the outreach on it? Let's go back to that slide.
Just let me know when to stop.
It was,
Did I
yeah,
go
it's
too far?
BHS. Yeah, I think you went too far. It's BHSS outreach and engagement.
Okay, right here.
Okay, Julia, do you want to expand a little bit more on what those outreach and engagement activities could look like for BHSS? I don't know if you have the policy manual handy. I know we've included examples in the policy manual. Or if there's someone else from my
Sorry.
team that might be able to.
Apologies. Can you hear me?
Yes, sorry, Julia.
No worries. Okay, so for outreach and engagement activities, first of all, just want to make the connection that in the policy manual, we cover the outreach and engagement for behavioral health services and support component in Chapter 7, and it's A.3. In the policy manual, we give different examples of kind of activities that could be supported with the BHSS funds. That would include any outreach and collaboration with individuals and entities that can help reach, identify, and engage individuals and communities in the behavioral health system. We give a variety of different examples, like community-based organizations, housing agencies, street medicine, field-based service providers, etc., as some ideas. Outreach can also directly reach and engage individuals who may benefit from behavioral health services and engagement to support and encourage ongoing participation of the eligible population in behavioral health treatment. And we give additional examples, peer support services, including resource navigation, food, clothing, and other basic necessities when the purpose is to engage unserved individuals and when appropriate, their families in the behavioral health system. I'm not going to go through all of them, but that's where you can find kind of some examples of the kind of things that can be included in outreach and engagement.
Thank you.
All right. I don't show any additional hands. I'm going to continue working through the Q&A in the meantime.
Okay, thank you. Can we move on to FSP? One more slide. Okay. So as I mentioned earlier with the CSC, DHCS is providing population estimates for full service partnerships, including ACT, FACT, ICM, and High Fidelity RAP. The estimates are developed in partnership with CalMesa and are expected to be available in the fall of 2025. Counties will review and use these estimates in their integrated plan, and these numbers are designed to inform your planning and resource allocation. And again, understanding these are large estimates of estimated eligible populations for each EBP. And we understand that resources are limited. So there is not, we understand that counties are not probably going to be able to serve their entire eligible population. Okay, we're also providing population estimates on the next slide here. In addition to those estimates for the eligible population, we'll also provide counties with estimates for the practitioner and team needs for each of the EBPs. These estimates are required to be included in your integrated plan. And we, like I just said, we do acknowledge that counties have very limited resources. and will likely be unable to support enough teams to serve the entire population. Next slide. Counties will provide the actual number of practitioners and teams that they plan to utilize over the first IP period. So this is where you get into your actual numbers based off of your current staffing levels or what's proposed. This number should include both existing personnel as well as any newly hired practitioners or established teams. We encourage counties to carefully review and adjust the practitioner and team estimates provided by DHCS. These estimates are a starting point. And your local knowledge of community needs and available resources is critical for determining the appropriate staffing levels for your county. Again, we will make available training and TA for practitioners and teams to support the delivery of ACT, FACT, IPS, and high fidelity RAP. Those will all be provided through the Centers of Excellence. So there's a lot of information coming out of those COEs. All of that is happening right now. And there's several calls that are happening locally to support the counties as they start implementing and rolling out all of the EBPs to fidelity. Next slide, please. A key requirement for your integrated plans is to detail your county's approach to enabling a rapid same-day access to medications for addiction treatment. So to effectively plan for the same-day MAT access, it's essential that you collaborate closely with your local partners to determine any gaps between your current MAT resources and your estimated needs. So we suggest that it could include engaging with your emergency medical services teams, law enforcement agencies, hospital EDs, as well as other community-based organizations. And as you develop your plan, you'll need to select from a list of menu of strategies that can be used to ensure the same day access to MAT. And that is a multi-select menu, so you can select as many of those strategies as you're planning to provide. When you're detailing your county's approach to the assertive field-based SUD treatment in your plan, it's important to provide a comprehensive overview of all your relevant programs. This would include programs funded by any source, not just those supported by BHSA. So when you're completing the table below, if your county offers assertive field-based SUD program that's funded by another source, and you are not planning on using BHSA funds to support the program, then the program would be included in the table. But column 5, which is titled the BHSA changes to existing programs, would not be applicable, and you would mark that as not applicable or type that in NA. Any questions?
All right, looks like we have a hand from Noah.
Can you hear me? Can you hear me now?
We can.
Yes, we can hear
Okay,
you now.
great. Great. So my question is, when you talked about reporting on programs, do we report out on each individual program, or do we report out on a work plan number? So, you know, the group of programs that, let's say, fall under MAT, or do we report out on each individual one?
Well, counties are reporting on each program, each MAP program, instead of rolling everything up into like an umbrella program or just like a single estimate. That would be, if you have multiple programs, then you would reflect multiple lines,
Okay,
is
got it.
how
Thank you.
I'm understanding it. Yeah.
Thank you.
Along that same context, Donna, we have a question in the chat. I think Julia's looking into it, but it was, do we include the DHCS CSC estimates and the adjusted estimates?
So the counties will get one, it'll be one worksheet of estimates, and it should include all 4 EBPs. So there'll be an eligible estimated population estimate with numbers. And then there will be a tool that goes along with that calculates the number of teams and practitioners that would be tied to that level of to that number of estimated eligible population. If that makes sense. It's hard to, I don't know if I'm describing it well, but it'll be a large worksheet that will have all of the information that you need to complete the table. And that should be, those estimates will be coming out in fall 2025.
And no additional hands right now.
Okay. Next slide. All right, housing interventions. As we move into the housing interventions planning phase, it's critical that counties begin by assessing their system gaps that are facing DHCS eligible individuals who are experiencing or at risk of experiencing homelessness. So to facilitate this assessment, you'll be asked to select the level of gap identified from a set of drop-down options for various settings and housing supports. To inform your understanding of these gaps, we highly encourage counties to refer to your local continuum of care housing inventory count and other relevant local data sources. That's where you'll, those will be the best sources to determine your gaps. The DHCS strongly encourages counties to implement BHSA housing interventions in close coordination with the broader homelessness response system in your category or in your county, excuse me. As part of your integrated plan, you'll need to describe your approach to collaborating with local housing partners, including continuums of care, public housing agencies, and Medi-Cal managed care plans. Your responses must detail how you're going to collaborate on implementation, which specific housing interventions you'll collaborate on, and if a county department other than behavioral health will be involved, how that collaboration will support implementation, and how the county behavioral health department will actually oversee and monitor these activities. As you describe the specific housing intervention services you will provide, it's important to provide the detailed information about each intervention. So this includes specifying whether the intervention will be provided to chronically homeless individuals or not. For each intervention, please provide a brief description that addresses whether the information will be provided directly by the county or through a contracted provider, whether another county department or local housing system partner is involved, and what specific services are being funded. Please also include the total number of units funded with these interventions. And if your funding is not tied to a specific number of units, there is an optional narrative box where you can provide an explanation for that purpose. For each capital development project you're undertaking, it's essential to provide a comprehensive description. So this includes specifying the applicable allowable settings for the project. Your description should also include the estimated capacity of the project, any non-BHSA fund sources that are being leveraged, total number of units being developed, the timeline for the development, and the expected cost per unit. And as I mentioned, if you're funding more than one capital development project, please be sure to include a separate entry for each particular project. Questions?
All right, we have a hand from Susanna. Showing oh,
my question is about again the estimates. I understand we're going to be provided with the estimates and the practitioners and the teams, but there was in the bullet points the county can adjustments to those estimates based on our local resources. Does that mean that we include those adjusted estimates, or is that going to be clear within the workbook?
Yeah, so the workbook is clear. There are two tables. There's a table one that requires you to provide the estimated eligible population and the estimated number of practitioners and teams to meet that number. There's a second table that is focused on your actual staffing supports that you have in place already. And so that's where you would adjust down those team sizes and the number of practitioners.
Actual already and what we plan to do combined, or?
Yes.
Okay. Thank
and
you.
I'm going to ask Talia just to confirm that I'm saying this correctly.
Thanks, Donna. Yeah, so the workbook that will be provided will include the estimates for population as well as practitioners and teams needed to meet that eligible population estimates. And then counties will separately in their integrated plan be providing the adjusted estimates that you develop based on local need, capacity, resources. So those you will be providing the adjusted estimates in the IP itself.
Okay, in the narrative, but in the narrative itself, do we also have to discuss or describe what the stated initial estimates were?
There will be a place in the IP to put in what the stated estimates
Okay.
are based on the workbooks that's
Okay,
provided.
that's
Yeah.
what I wanted to know. Thank you.
Yeah. Mhm.
Thanks, Talia.
All right, we've got a hand from Catherine.
Hey there, this is Catherine from LA County. I actually had a question relating back to a previous section on BHSS, where it looks like all of those sections are going to be referring to BHSS funded programs. But under assertive field-based SUD, I recall being mentioned that that would include programs that weren't necessarily funded by BHSA. Is that correct? And are there any other sections within BHSS that would refer to programs not funded by BHSA?
The SUD field-based initiation should include sources outside of BHSA.
Okay.
Because for that area, if you're using other sources of funding for that type of project or that work, we would want to see that because there is a requirement that counties, implement this field-based SUD. And if you're using other funds to do that, that would meet that requirement. So that's
Okay.
why it's important to include that information on there. And then if you're planning new programs, we would want to know that as well. And as far as other sections in BHSS or BHSA, that might come up in the budget where you're using other fund sources, but if it's solely funded with something outside of BHSA, I don't believe that there are other sections where we would want something like that included.
Okay, got it. So that one section is the only one where if it's solely funded by another source, we would still report on it.
I think so. I don't have the template in front of me right now, but that's what I'm thinking. The budget though there are more budget forms, and we're going to talk about that in a future webinar where we're going to do more of a walkthrough on the budget forms, and that's where I think some of those larger programs that are outside of like BHSS, that's where we're going to capture that type of information, and we'll be using the care continuum to reflect that type of information as well.
Okay, thank you.
Sure.
We've also got a hand from Karen.
Can you hear me okay?
Yes.
Okay, great. I have questions for the two cities because we have to use the county population estimates as well as, their measures and the different priority measures. There's going to be times where that doesn't make sense. What is popped out in terms of the estimates of maybe staffing, as well as sometimes the county has different things they have to meet that the cities don't. And so I'm just wondering if the portal, I haven't been all the way through the portal. I've been slowly getting through places, but I'm just wondering if there's going to be some allowances in there for adjustments or places that say this is not applicable because it's a city, some kind of that then helps everyone to understand not only our community, but DHCS and DHCS's monitoring team. Because otherwise it's just not going to, we're being compared to all of Alameda County, and we're a small population within Alameda County. We're big, but small. So, so I'm sorry to take up everyone else's time on that, but I'm getting a little anxious about how that's all going to play out. And if you're just popping things in based on other, counties, information, the full county's information, it's just not going to make sense to anyone.
No, I think that's a great question. We do have areas in the template where, like counties, we've specified that cities do not need to complete certain parts because it's just not applicable to them. But as you're going through it, if you're running into challenges or there's areas where you have specific questions, I would say we can certainly like have a separate call with you and Tri-Cities because you're both in that same situation, and that might be a good opportunity to just kind of walk through your particular specific questions. If that works.
That'll work. Thanks a lot.
Showing no additional hands right now. We did have a question from Raven asking if the template could be updated to specify whether counties are to report on BHSA only funds versus all programs, so that it's clear to the counties.
We're not looking to make changes to the templates at this point in time, Raven, only because we know that counties are starting to work on it. And it wouldn't be fair to the counties if we were continually making updates. We also have a particular process that we're following for making updates to the policy manual as well as the integrated plan templates. So, but why don't you let me know what exactly your questions are, what you don't think is clear, and then I can absolutely, we can look into that and see if there's any workarounds, or maybe there's, some additional TA we can provide or something like that.
We've got Raven with her hand up as well.
Oh.
Perfect.
Thanks,
Go ahead,
Donna.
Raven.
Hi. I think what I'm trying to say here is it seems like, and we've had questions from other counties that have lifted this up as well. And so I think the reason why I was suggesting that the template get updated, just to kind of note that, is to ensure that counties are entering the right information that DHCS is expecting to see, because what may happen is that counties may interpret it in different ways, and you may not end up getting the data that you truly are looking for. So it might be, I understand that the template's built and you all are kind of done with that piece of the work, but I'm just thinking, for those that may not be looking at FAQs and may not be looking at other pieces where some of this information might be available, if that's just a possibility to include that in there, just so that it's really clear and DHCS is then receiving consistent, correct information from counties across the state.
Okay. Yeah, that's good call out. We can we can talk with the product team also, because maybe that's not necessarily like a template. We wouldn't be changing questions, but maybe it's just a little bit more guidance in the template inside the portal itself is what it sounds like would be helpful.
Yes, yeah. So, when it asks the question, please report on, your programs for assertive field-based services, for example, it might include something that states this would include your BHSA and non-BHSA funded programs. Same thing with other sections within BHSS or, other areas in the IP data part, again, kind of specifying only include your BHSA funded programs, for FSP, for example. So I think having that language in there would really provide that clarity. And again, we're just kind of thinking ahead of ensuring that whatever counties are putting into this portal is what DHCS is looking for, and that it's consistent across the board, rather than, finding out later on that everybody did it a little bit differently, and we know what a mess that can be later on. So just trying to think ahead on getting some of it cleared up where it can. So appreciate the consideration and you taking that back, Donna. Thank you.
And I just want to call out, I totally appreciate that feedback, Raven, but just so that everybody is aware, in case you haven't been in the portal yet, we have tried to include within each section, links to the particular part of the policy manual, or if there's something in statute that's helpful, so that it's almost like a quick link. We also have some like language that kind of instructs the counties a little bit more, provides a little bit more context. And so when you get into the portal, and I think the counties will start seeing some of that. We're hopeful that that is helping the counties. But appreciate the extra input, and we'll see if there's other things that we are able to make, other fixes.
All right, no additional hands.
Okay, this is going to be a very short section, one slide. This is the Innovative Behavioral Health Pilots and Projects section. And just want to point out, it's important to clarify first off that under BHSA, there is no specific innovation component like there is under MHSA. Counties are encouraged to pilot and test these innovative behavioral health models of care programs or practices within the existing BHSS, FSP, and housing intervention components. We don't want to limit that only to BHSS funds. So for each of these innovation or innovative projects, counties would need to report how the program will contribute to building an evidence base for the effectiveness of new statewide strategies. And this would include detailing intended outcomes, specifying which components going to be funding the project, and being sure to include that information within this particular section. Any questions about those innovative behavioral health pilots and projects?
All right, looks like Zakaya.
Yes, hi. For the BHSA innovative projects, so does this mean that we can just pilot our own projects without going through that innovation approval process?
Yes, the innovation approval process was something that was in statute under the Mental Health Services Act, and all of those programs were, and that funding was operationalized by the OAC, the Oversight and Accountability Commission. The innovation component is no longer. And so, but we did want to, that is important, innovation and innovative projects. So with that, there is a section that does allow counties to, pilot these types of projects that, to see how they work within your local community. And so this is your opportunity to do that outside of that process. It's locally controlled, and you just have to kind of explain what your project is and what those outcomes are looking like and how you're intending to fund it in your integrated plan.
Great, thank you.
Any other questions?
We've got some questions related to innovation in the chat. We've got one from Juan asking about what the incentive would be for counties to divert funds from certain programs that have been in use in order to test out innovative approaches.
That would be that's a local decision. If however you choose to utilize your funding, the department is not expecting counties to, or instructing counties to do any, spend their money in any particular way for the innovative projects. But if this is an opportunity and the county wants to take advantage of it, they're more than happy to do that, or more than welcome to do that through their integrated planning process.
All right. And no additional hands right now.
Okay. So the workforce strategy section, in this section, counties are required to ensure that their county operated and county contracted behavioral health workforce is well supported, culturally and linguistically responsive with the population to be served. So in this section of the IP, counties should state whether their BHSA funded providers will follow the same standards as Medi-Cal providers. And if the standards differ, counties should describe the qualifications and processes in place to confirm that BHSA funded providers are prepared to deliver behavioral health services that are culturally and linguistically responsive to that population. And in addition, counties are required to assess their current workforce gaps and describe both present and anticipated workforce needs. just to kind of highlight the differences between the workforce strategy and the workforce education and training sections. So the workforce strategy section focuses on monitoring and assessing the county behavioral health workforce. This section does not require counties to report on BHSA fund usage. And then counties should also outline their plans to leverage BH Connect in the integrated plan. In contrast, the WET section within the BHSS component is specifically designed to support activities that are related to the recruitment and retention of your county behavioral health staff. Any questions on that workforce strategy section? Okay, are there any hands?
No
going up?
hands.
Okay. This is the last slide before I go into next steps. So I'm wondering if there are questions, maybe related to previous sections that we've talked about today.
I'll wait for raised hands. I have a question in the chat that's slightly unrelated that I'm working on, but yeah, we'll see if any hands come up. All right, Priya.
Sorry, can I go back a section if possible to innovation? A question on innovation. If we have an innovative project that is under MHSA innovation, so for example, we had an innovative project that was approved this year and it's a 5-year project. Is that an appropriate place if we're using carryover funds from MHSA innovation bucket? Should we be reporting on that innovative project in the innovative bucket under BHSA?
So I'm glad you brought that up. So under MHSA, what we have decided is that we realize that counties have a certain, time frame to spend those innovation funds, and they may have already, encumbered those funds into a particular project. So what we have decided is that essentially those MHSA innovation funds can stick within that project, and you would add that particular project into whichever of those current components it would fit into and align with. So if it may fit in best under the BHSS section. So if that's the case, you would reflect the project in that section with whatever the name is. And then actually, you know what? I think I'm misspeaking here because Teresa and I were just talking about this. Teresa, are you on the call, Teresa?
Yeah, I'm here.
Can you just explain the innovation piece and where it should be reflected for counties that are rolling forward their innovation projects? Because they're not particularly, and they shouldn't be part of this innovative projects pilot.
Right. So we're talking about that whatever the approved innovation project is that's under MHSA, however it best aligns under BHSA with the new BHSA components, that it should be reported that way just for the budget. And then there'll be more things in detailed in the voter.
Okay.
As far as the spend down of the funds.
Yeah.
Yeah, I think my only concern with kind of lumping it into one of the existing BHSS components is the distribution, like meeting the distribution. So for example, if we have quite a large innovation project with a large number of innovation funds, that may take up 25% of our BHSS budget now and leave less money for the planned programming that we have under BHSS because we originally dreamed it up under the innovation bucket, not really under the CSS bucket, for example, if that, draws the line between CSS and BHSS.
No, that's a great point, and I'm glad you brought that up because I know that we accounted for that in the policy when we were developing it. Let us look at the budget templates again and kind of go back and rethink that, and we can provide a better response on it. Because I agree, it shouldn't take up. We don't want to throw off those ratios of the early intervention requirements as well as the within early intervention, the 50% that needs to be spent on children. We don't want to mess up anything like that. So, thank you for bringing that up. More to come.
Oh, we've got a hand from Raven.
I believe the integrated plan budget template is set up in a way for those MHSA dollars to not get calculated in the distribution or in the BHSA distribution. So just wanted to flag that.
Thanks, Raven. That's what we
Yeah,
were that's what I was hoping.
Yes, yeah. I remember looking at that just recently, and the way that if it's in the BHSA transfers tab, it's down below. You can see how like where counties can actually enter in those rollover dollars, and it doesn't impact your percentage distribution. The 30, 35, 35 is calculated on the BHSA revenue, not the rollover from what I was looking at and playing around with. So.
Thanks, Raven. Super helpful for pointing that out, and appreciate the insight. We'll be talking about the budget more at the next webinar that's scheduled for a week or so, the 26th, I believe. Are there other questions?
No hands raised. I think we're good.
Okay. As far as our next steps, again, as I just mentioned, we are going to have a another webinar. This will be the third and final webinar for this series. We're going to be talking about the integrated plan budget, transfers and exemptions. And it looks like Rocco just dropped the link into the chat in case anybody hasn't registered for that training yet or that webinar yet. Also want to highlight, we have a resources tab that's within the integrated plan or the policy manual. And we've added some resources in there. We're continually trying to add more resources to support the counties as they complete these integrated plans. There's a couple of training videos on completing the budget. We're working on an FAQ document that should be posted shortly. And these webinars that we're presenting right now will be all, those are all being recorded and they will be posted. If we are also sharing out the slide decks. If we are slow on remediating it, we will still provide it to we'll provide it to CBHDA, and they will hopefully be able to send that out to the counties just because it's a little quicker than waiting for that remediated version to be posted on the web. Are there any other last minute questions before we log off for today?
There was one additional question in the chat. Donna, you may be able to help answer. The CAO approval letter requirement in policy states that it's a requirement for the draft. Do we know if it's a requirement for the final as well?
The CAO is just for the draft.
Perfect, thank you.
Yeah.
And then we've got a couple questions. Let me just scan through them. Louise, I'll go ahead and post that link in the chat as well for where we expect the recordings to go. All right. Sorry, questions are still coming in. Stella, I see your mentions of difficulties with the county portal. If you can send an email over to the dhtinfo@dhcs.ca.gov, we can try to assist you a little bit more if you can't access any information in there. Question, is the COE required to review and approve the final IP before submission to DHCS?
They're required to review the draft IP. Not the, there's no requirement. I mean, if they're going to do that on their own, or how, if that's what the locals require, that's fine. But the final will be handled by the Board of Supervisors, which I think oversees the CAO as well.
Perfect. And those are all the questions that we have. Oh, wait, there is a hand from Katie. Katie, I'm putting you on mute. Still have the hand raised, but you're on mute.
Katie, you can unmute yourself now. You're still muted. There should be like an audio button on your bottom left.
Yeah,
You can
sorry,
unmute
that
yourself.
was an error.
Okay.
All right. Well, thanks to everybody for joining the call. As usual, if you have any questions at all, please use the, there's a service center that's in the product, the county portal. We also have the BHT info or email address for any questions that coming in there. There's the MHSA inbox. I mean, you can email me directly. We have a lot of opportunities for questions, so please feel free to send those in as you're coming up with them, and we're happy to respond and provide you with a response. All right, we'll see you in a week and a half, I guess, for the next version of the webinar. And then we also have some product webinars too, if you haven't participated in the first two. Those are, it's just a road show, so we're repeating the information. I don't have a list of those dates in front of me. The product team may have those available. If not, we'll definitely send those out with the notes from this call. Okay.